Hi friends, today I want to help you and your loved ones overcome IBS or Irritable Bowel Syndrome. First, let's talk about IBS versus IBD. Let's also talk about the causes, the symptoms of these disorders. And then, of course, let's discuss the harmony way to heal IBS or Irritable Bowel Syndrome. Now, IBS is a functional gastrointestinal disorder that affects the large intestines, and it causes a variety of different symptoms without any actual structural damage. It's important to differentiate this from IBD, which is known as irritable bowel disease. Irritable bowel disease is an autoimmune disorder where our antibodies flare up in our immune system, and our immune system starts to attack our gastrointestinal tract. This is characterized by two main diseases, such as ulcerative colitis and Crohn's disease. For the sake of today's discussion, we'll be talking about irritable bowel syndrome exclusively. So let's talk about some of these symptoms of IBS. And the symptoms can vary largely. Some of them being digestive issues, alterations between bloating to gas to diarrhea to constipation. Some of them being abdominal pain like cramping or discomfort, which is typically relieved by a bowel movement. For some, they'll find mucus in their stool. Some patients notice that there's a white coating that surrounds their stool. For others, it's change in bowel habits like urgency or incomplete evacuation or inconsistency in stools. For some, it may be non-GI symptoms like fatigue, sleep disturbances, anxiety, depression. All of these can accompany the GI symptoms. Now, symptoms are often triggered by certain foods, certain stressors, and even your hormones. While the exact cause of IBS is still unclear, IBS may result from a combination of different causes. Some of those causes are gut dysbiosis, which is an imbalance of the bacterium in your gut. It may be food sensitivities. Certain foods may be triggering you, like gluten or dairy or high FODMAP foods. Some of these are triggers. Stress in the brain. It's very important that our gut-brain axis is functioning properly. The gut and the brain, they communicate via the vagus nerve. And when there's a stress response, it's going to disturb our digestion. For some, it may be gut motility issues, either too fast, like diarrhea, or too slow, such as constipation. For some, it may be inflammation or post-infectious IBS. And in some cases, prior to the gut infection, you may see triggers come along with things such as IBS symptoms. For some people, it's small intestine bacteria overgrowth, or also known as SIBO, where there's an overgrowth of bacteria in the small intestines, and this can also mimic what's called IBS. Now you may ask Dr. Cooper, what's the harmony way? Of course, I'm glad you asked. The harmony way to treat your IBS condition is to take a root cause approach. Rather than just managing your symptoms, we have to identify the actual cause first. So the first thing that we want to do a comprehensive gut test and analysis. We may check your stool to assess for your gut microbacterium health. We may do things such as organic acid tests to tell us a little bit more about the possibility of gut dysbiosis. We may want to do a breath test to test for things like SIBO. And this will help us to identify the bacteria overgrowth that may be taking place right now in your small intestines. Now, number two, the second thing we want to do is we want to make sure that your diet and your nutrition strategies are appropriate for managing your condition. We may want to do like an elimination diet where we remove certain triggers like gluten, dairy, or high FODMAP foods. We may want to do a low FODMAP diet. And if you haven't heard about it, simply it's reducing your fermentable carbs that can cause bloating and gas. We may want to do some nutritional support and adding things like digestive enzymes, probiotics, prebiotics, and other enzymes that are tailored to improve your gut balance. And hey, since we're already talking about supplements, some of the probiotics may be probiotics like Lactobacillus bifidobacterium to restore your microbiome balance. These are targeting probiotics that really can help restore your gut. We may also want to do targeted antimicrobials for dysbiosis or SIBO. And these are relatively sparing of your good bacteria. And of course, they're going to go hard at the bad bacteriums. Next, we want to make sure that we're healing your gut with gut nourishing supplements like L-glutamine or things like zinc or carnosine or things like aloe vera to support the intestinal lining. There are some other good things that you can consume as well, like bone broth or collagen peptides to restore the gut lining. And since we're still talking about supplements, don't forget your hormonal balances. Your hormonal balances are very, very important. Managing serotonin, which influences your gut motility and mood, is very, very important. Optimizing your thyroid and your adrenal function is also very important, and they contribute to your IBS symptoms as well. Next, we want to address your stress. This is so important, folks, because your stress is going to upregulate your nervous system. And oftentimes, it's going to downregulate your relaxation, your ability to relax your gut. Okay, so we want to be mindful of techniques like meditation, like deep breathing, vagus nerve stimulation, sleep, proper exercise, and of course, sun time. So these are our steps. This is the Harmony Way. We want to help you starting today by addressing your gut health, your diet, your stress, and your underlying imbalances. Functional medicine offers a personalized, long-term approach to IBS management rather than just suppressing your current symptoms. We would love to know what your approach has been and what's working for you right now. So go ahead and comment below and let us know how you have been managing your IBS so far.
And Harmony Chiropractic and Functional Medicine, cultivating a climate for wellness.